BC needs to continue to brace against COVID-19. There is hope on the horizon, BC's top doctor says, but more tough times first.
No surprise to people, we continue to see high rates of virus transmission across British Columbia, and this is anticipated to continue for the next few weeks.
Looking at other regions that are in this Omicron wave and how fast spreading viruses like this usually function, she's hopeful cases could be leveling out. But how many cases in this surge will become serious remains a question.
We still don't know the full effect that Omicron and the rates of hospitalization that we're seeing now are going to have on our healthcare system and the level of care that's going to be required in the coming weeks.
Right now, nearly 96% of BC's standard hospital beds are occupied, as well as 87% of ICU beds. There are also additional surge beds and contingency plans in place.
We'll be securing additional space capacity for a field hospital in the Lower Mainland, including potentially converting the space we are using right now for the mass vaccination clinic at the convention center, and could have a hospital set up in 5 to 7 days.
He's clear that is not the case now, not yet. To bolster the battle against this virus, hoping to add new medications to the arsenal before the end of the month.
A number of new antiviral medications, particularly Paxlovid, also molnupiravir, that are under review by Health Canada, and we're hopeful that those will be available. Another important tool to help us keep people out of hospital.
What is absolutely keeping out of the hospital now, she says, is vaccines. Of those in BC's acute care, most are unvaccinated, including 3 in their 20s and 1 in their 30s.
That is a preventable illness. It creates a lot of distress for our healthcare workers to be caring for young people and seeing them in so much distress when it can be prevented.
The clearest protection now as this wave crashes, Henry says, is getting a dose if you don't have one, or your second and booster if you do. And though it will be rough ahead, there's no escaping that. The end may be in sight.
There are many, many unknowns, but just from our prior experience with similar parameters around incubation period and transmissibility, we would expect this to be a shorter wave.
In Victoria, Liza Yuzda, City News.